So I think the implications of yesterday's decision in the Supreme Court are quite profound for US healthcare. This is really a green light to press ahead with all of the reform agenda that many of our health systems and the payer community have been working on for the past 2 years. And it's a vote of confidence in many of those initiatives, particularly the accountable care organisations which are being developed in US health systems, but also in the approach towards new models of reimbursement and really a drive towards reducing cost in the system as well as improving access.
The Supreme Court decision upholding the Affordable Care Act actually presents an opportunity to move forward. There's been a lot of uncertainty in the community, both on the payer side and from the medical industry itself. Now moving forward, we're going to see people get back to business, and the paralysis should be over.
So for the payer community, we see really two implications. The first is an upside opportunity, the second is a risk. The upside is clearly an opportunity for greater revenue, somewhere in the region of 10% per year, as a result of obviously the increase in the population under insured coverage. The risk is also profound. They are going to have to find new ways to produce lower cost plans which appeal to a community of low income participants, and also they're going to have to participate in the creation of state insurance exchanges, many of which have yet to be even designed.
Well, the payers have a substantial opportunity here because they're going to increase their rolls. They're going to see costs come down because people who have previously been uninsured are no longer visiting emergency rooms. They're getting better treatment, which should drive the cost of care down overall because that hits everybody's premiums in the United States anyway. So I believe that they're going to be able to innovate some of their programs and work from a bigger population base.
So for the majority of states, they are yet to actually design their state insurance exchanges. Clearly that's going to be a major challenge for them in a very tight schedule. The federal government is looking for a formal plan by the end of 2012 and for implementation by 2014. And that 2-year window is very, very tight for the design of some very complex structures that both benefits managers in large employers and indeed the health insurance plans are yet to fully understand.
The biggest implication from the ruling for state governments is that there still are big political issues. Half of the states actually were party to this case. The short-term objective is they need to get their health information exchanges put together, and they have to modernize their Medicaid programs, and that's going to be a big challenge in the short time frames that are required.
For pharma, I think the really interesting implication of the decision in the Supreme Court is that this presses ahead an agenda of collaboration. With the development of accountable care organisations and patient-centred medical homes, there's an increased focus on population outcomes and on the development of population solutions which require integration across the health system. Pharma has a real opportunity to be a participant in that collaboration, and in fact we're seeing many examples of large pharma organisations working with specific health systems to try and develop collaborative solutions.
Pharma has been facing into the idea that they need to collaborate with the payers for some time now. This takes some of the uncertainty out of that. They can focus on more holistic solutions to healthcare problems and collaborate with the insurers for the best possible drug and treatment combinations.